This is something that we need. It's something that's good for patients. It's good for providers. It's good for policyholders of private insurance. It's good for patients because, as Representative Gottwald said, this provides more choice and more coverage. It's good for providers because it provides a better reimbursement stream and also removes a cap, so it's better for providers as well. It's good for policyholders because if you've tried to purchase individual insurance or insurance for your small business, you know that it's getting more and more difficult to purchase every single year because the costs are driven up higher and higher and higher by an ever-increasing cost to private policyholders. And there's been a lot of talk about is this an exchange or not? Obviously, it's not an exchange. This is a way for people to purchase individual health care, number one. And number two, what does this have to do with the federal bill that was passed? It's going to be one of our state-led solutions that we're going to need moving forward because we need Minnesota solutions. Minnesota should lead and not follow in health care reform, and this is one step that we can do that. And in fact, it's exactly the opposite of the federal health care bill. Because what the federal health care bill does is it says we're going to take folks, small businesses, large businesses, and we're going to take you from private health care insurance and we're going to switch you over to the public programs. And what that does is it continues to drive down reimbursement and drives up the cost of private health care insurance in the state of Minnesota. What House File 8 says is that we're going to take folks who are currently on public programs, we're going to offer you a private choice. You will go out and purchase your own plan. And that choice will help policyholders who have these new plans and also those folks who buy private health care insurance. And lastly, we have to look at our current Minnesota care and the solvency of the Health Care Access Fund. We were just talking about that, in fact, today in the Health Care Committee. And we're going to be running a deficit within that very soon, and we're going to need tools and pathways to solvency within that fund, and House File 8 will also help us do that. Once again, thank you, Representative Gottwald, for this really patient-centered bill. It helps policyholders, it helps providers, it's a ticket out, and it's a Minnesota leading solution. I encourage members to vote green.